Safety data from the HER2CLIMB study was very consistent with what we saw in the phase 1b study. The most common adverse events were again noted to include diarrhea, hand-foot syndrome, nausea, vomiting, and fatigue, and these were all mainly low-grade events. Liver transaminase elevations were also noted with the addition of tucatinib, but again, these were mostly low-grade, transient, and reversible. And we were essentially able to confirm that this is a very safe and tolerable regimen for patients. So one of the features of tucatinib that is important from the perspective of tolerability and safety is that it is HER2 selective, and it does not inhibit EGFR. We know that EGFR blockade does not seem to be critical in terms of enhancing efficacy of HER2 blockade, but it can be associated with more unwanted side effects such as diarrhea and rash, which can be seen with other drugs within this class of tyrosine kinase inhibitors that do inhibit EGFR in addition to HER2. So the HER2 selectivity of tucatinib is a very important feature of this particular drug that has shown to be associated with less toxicity and therefore translates to improved quality of life for patients, which is really important.
I think that this is going to be a standard of care in this setting. I think it's a well-tolerated regimen. It has side effects that we can easily control, and really meeting all 4 endpoints of progression-free survival, overall response rate, overall survival, which is really our gold standard, and progression-free survival in the brain met population proves that it's very active and a very valuable tool in our repertoire.